So I have a special word for caretakers, kids with CP, parents and others, guardians, other relatives, and people who are in the hot seat when it comes to seeing that all the facets of rehabilitation of a child with cerebral palsy are up and running. And I would have to tell you that I acknowledge the tremendous burden and the requirements on these families who care a great deal to do all they can for this child and who run into limitations. Limitations on time, resources, confidence in their own skills, competence in their own skills. Thinking that, they should be doing more. Most parents I know think they should be doing more. So one of the reasons I developed TheraTogs, not only to benefit your kid with enough practice and functioning alignment, but it was also to find a way to help you help your kid in 10 minutes or less. And by delivering for your child functioning alignment that he or she can't muster on his own, but that you could make so underneath their clothes each day. And I realize that's 10 more minutes in the morning, and mornings can be difficult, and school to get ready for, and breakfast, and maybe other children. I understand that. But cerebral palsy is so complex. And I'm asking you to do the simplest thing I can think of for you to do. And that is get your kid in a garment set and help him out with his trunk a little and get that functioning alignment that he or she needs to practice all day. And then you can hang up your therapy hat pretty much for the rest of the day, getting him into the gear that he needs to operate most optimally. So believe me, I don't ask you to do this lightly. I understand that there's tremendous complications in caring for a kid like this. And I do know that you care a great deal. And I'm trying my best to give you the strongest tool I can to intervene for your kid in a way that is productive for both of you, that takes nothing away, that doesn't shoot any muscles full of toxin, that doesn't clip any nerves, that doesn't lengthen any tendons and weaken the muscle for life. There's no scars, there's no medicine, there's no needles. It's just a garment set. And it's a garment set with possibilities ready to be built into it that you can make so. So if it turns out you can tolerate it for 5 days a week, 8 to 10 hours a day, maybe you want to take Saturdays off, I won't run your life. I'm going to ask you to help your kid. And you'll be amazed at how much more therapy you can give him through these TheraTogs than you could possibly afford or take him to in the therapy setting. TheraTogs are cheap compared to therapy. If you had a therapist come to give your child 8 to 10 hours of therapy a day, what would that cost you? And in one day, they're paid for. In the first couple hours, they were paid for. And you're going to get a minimum of 6 months of daily wear out of a garment set, an undergarment set, which delivered hundreds of hours of therapy for pennies. So let's consider the fact that you don't have to do exercises. You don't have to feel that the therapy is out of your reach, that the therapist is asking you to do stuff that you really can't do. But please help us help your kid by carrying over, by providing the carryover between therapy sessions that gives him the training that we're looking for. Thanks for all you do for your kids.